All right, let's jump into another deep dive. Today we're going to get into prepping for dental implant surgery. We're looking at the Orastock pre-surgical guidelines, and I got to tell you, there's some really interesting stuff here. I bet you wouldn't find this just by casually searching around on Google.
Absolutely. It's super important for people to be in the know, especially with something like surgery.
Definitely. When you're talking about surgery, feeling informed and confident, that's priceless.
Exactly.
So let's get right into it. What's the most important thing people should think about before even scheduling their surgery?
Well, you gotta be totally transparent with your dentist about any medications you're taking. I mean, everything. Even if it's like, just an occasional aspirin or like some herbal supplement you've been trying.
Okay, so full disclosure. But
Yeah.
is it really that big of a deal? I mean, why is it so important?
Yeah. Oh, it's huge. Some meds can really mess with things when it comes to the anesthesia or even blood clotting. And, obviously blood clotting, that's like a big deal when you're healing after surgery. Sometimes those interactions aren't super obvious either. So even if you think it's no big deal, tell your dentist anyway. Better safe than sorry, right?
Right, right. So what happens if for ET, a potential interaction? Like, do they have to postpone the whole surgery?
Not necessarily. Your dentist is kind of like a conductor. They want to make sure everything goes smoothly. They might adjust your meds or even talk to your doctor, especially if you have like a chronic condition, to make sure everything is good to go, if you have diabetes or anything like that.
Okay, so it's a team effort.
Exactly. Teamwork makes the dream work, right?
I like that. So speaking of teamwork,
All
how about
right.
those pre-surgery antibiotics?
Those are super important. Think of them as your secret weapon to prevent infections. Sometimes you actually got to start taking them the day before surgery, just to give your body a head start.
Wow, I had no idea. So timing is key.
It really is. And speaking of timing, let's talk about those lifestyle changes that can make a big difference. We're talking about smoking and alcohol, of course.
Ah, those are always on the no-no list before any medical procedure.
Yeah, and for good reason. Here's a crazy fact. Even one cigarette after surgery can seriously increase the risk of your implant failing. That's why it's super important to pick the habit, like ideally 2 weeks before and after your surgery.
Wow. Okay, no sneaking a smoke break. Got it. What about alcohol? Is that a hard stop too?
Pretty much. Alcohol can really mess with the anesthesia and medications. It makes things unpredictable, which we don't want. So no celebratory drinks for at least 48 hours before your surgery.
All right, no last hurrah. So we've got our meds sorted, lifestyle adjustments in check. But what about those pre-surgery jitters? Got any tips for calming those nerves?
Well, knowing what to expect can really help ease your anxiety, but there's definitely more you can do. Deep breathing, meditation, even listening to your favorite calming music can work wonders.
Basically, create your own little pre-surgery zen zone.
Exactly. And don't forget about setting up a comfortable space at home for after your surgery. You'll want a comfy place where you can relax and recover.
Oh yeah, I'm thinking pillow fort, fluffy blankets, and all my favorite shows ready to go. Plus a snack station full of soft, cold goodies.
Sounds perfect. And don't forget to grab all the essentials beforehand, like a soft bristled toothbrush, antibacterial mouthwash, a cold compress for swelling, and some over-the-counter pain relievers.
It's all about being prepared. I'm a pro at prepping, but even I forget things sometimes. So having a checklist ready to go is super helpful.
It is. And speaking of preparation, don't forget about transportation. You won't be driving yourself home after surgery, so make sure you've got a ride lined up.
True. Even if you think you'll feel fine, it's always better to be safe than sorry. That's what friends are for.
Exactly. And it's nice to have someone around to help out, especially in those first 24 hours, with meds, food, and just keeping an eye on you.
So meds, lifestyle, calming those nerves, getting your recovery spot set up, and making sure you have a ride. What about the morning of the surgery? What should people do right before heading to the dentist office?
Stick to your usual oral hygiene routine, brushing and flossing, but on the day of the surgery, you'll want to avoid swallowing water or using mouthwash after brushing, unless your dentist tells you otherwise.
Really? Why is that?
You want to minimize the bacteria in your mouth. We are talking about a surgical procedure after all, so we want to do everything we can to prevent infection.
Wow, I never would have thought of that. So even brushing our teeth plays a part in setting ourselves up for success.
You got it. And another key ingredient for success: arrive early. Aim to be there at least 30 minutes before your appointment time.
Is that for paperwork, or is there something else going on?
Yeah, paperwork is part of it, but it also gives you some time to settle in, relax, and maybe do some of those calming techniques we talked about.
That's a great point. It's always nice to have some buffer time to gather your thoughts and just chill out. Okay, so arrival time, paperwork. What about food? Can you eat before the surgery?
It depends on the type of anesthesia. If it's local, you might be able to have something light to eat earlier in the morning. But once you've brushed and disinfected with mouthwash, no more eating or drinking anything until after the surgery.
Okay, so no snacking on the way to the dentist. We've covered a lot, from medications to making your own Zen zone, but now it's time to talk about the actual procedure, the dental implant surgery itself. What can people expect once they're in the chair?
We'll get into all the fascinating details about the procedure right after. Well, we'll get into it in just a sec. All right, so we're back. Before we took a little pause, we were talking about all the things you got to do before dental implant surgery to make sure everything goes smooth.
It's crazy how many little things can actually make a big difference.
Yeah, absolutely. But now let's get to the main event, the surgery itself.
Yeah, let's walk through it. Like, what can someone expect when they're actually in the chair?
Well, first, they'll probably do some routine checks, like your blood pressure, make sure your temperature is good, that sort of thing. Then they'll get you all comfy in the chair and ready to go.
Okay, so far so good. But I bet this is when the nerves really start to kick in.
It's totally normal to be nervous, even with all the preparation you've done. Remember those relaxation techniques we talked about, like deep breathing and visualization? Now's the perfect time to use those.
You know, I've heard that some dentists even have like aromatherapy or calming music to help people relax.
Yeah, for sure. Some offices really go the extra mile to make you feel comfortable. And remember, it's super important to communicate with your dental team. Let them know how you're feeling. They're there to support you every step of the way.
So we're in the chair, we're breathing deep, maybe enjoying some relaxing tunes. What happens next?
Next up is the anesthesia. Usually, it's just a local injection to numb the area around where the implant is going to be placed.
Yes, the part that makes some people a bit squeamish.
Yeah,
But hey, it's what makes the whole thing pain-free, right?
absolutely. Anesthesia has come a long way. You really shouldn't feel any pain. Maybe some pressure and vibration, but no pain.
Speaking of sensations, what about that water spray I've heard about?
Oh yeah, that's normal too. The dentist uses it to keep everything cool and clean while they're drilling. Might feel a little weird, but it's nothing to worry about.
Okay, so the area's numb, we've got the water going. What's the next step in this whole implant process?
Okay, so once that anesthesia has kicked in, the dentist is going to make a small incision in your gum to expose the jawbone. That's where the implant's going to go.
So it's not just like popping the implant in, they have to actually prep the jawbone.
Exactly. They use special tools to create a little hole in the bone and shape it to fit the implant perfectly. You might hear some drilling sounds, but remember, you won't feel a thing.
All right, so far so good. So what happens next? Does the implant just slide right in?
Pretty much. They'll carefully place the implant and make sure it's nice and secure. Depending on the implant and your specific case, they might put a healing cap on top or stitch the gum closed.
Wow. So the implant's in place now. Is the surgery over?
Yeah, the main part is done. They'll probably take you to a recovery area so they can monitor you while the anesthesia wears off.
Makes sense. It's probably nice to just chill out for a bit before heading home.
Exactly. You know, even though the surgery focuses on placing the implant, it's important to remember that this is just the beginning of the journey.
Oh, right, right. The implant has to fuse with the jawbone. You talked about osseointegration earlier. What exactly is going on during that time?
It's a pretty incredible process. Over a few months, the implant and bone basically become one. It creates a really strong foundation for your new tooth.
That's amazing. So the surgery is all about making sure that fusion happens successfully.
Exactly. The surgery sets the stage for osseointegration. That's why all those pre-surgery preparations are so important.
That makes total sense.
Uh,
It just goes to show how important it is to choose an experienced dentist for this whole thing.
Couldn't agree more. You want someone who really understands how this process works and who has a great track record with implant placements.
So we've talked about all those pre-surgery guidelines, the actual steps of the surgery, and even the science behind how it all works. What happens after the surgery's over.
Well, that's another conversation for another time.
That's true. But for now, I think our listener has plenty to think about as they prepare for their implant journey. Thanks for breaking it all down for us. I feel way more prepared and less nervous about the surgery now.
Happy to help. I think it's important for people to feel informed and empowered when it comes to their health.
Absolutely. And to our listener, we hope this deep dive has been helpful. And you know, even though surgery can seem kind of scary, it's good to remember why you're doing it. Implants can really change your life. You'll be able to smile, eat, and talk with confidence again.
That's a great point. It's about improving your overall quality of life.
Exactly. Well, thanks again for joining us and sharing your expertise. I know I feel a lot more prepared now.
You're welcome. I'm always happy to help.
And to our listener, we hope you found this deep dive helpful and encouraging. Remember, with the right preparation and a great dental team, you can go into this with confidence. Thanks for joining us on the deep dive. See you next time.